Namaste, all of you. Today we are going to discuss a new topic, and this topic I am discussing here on request of our undergraduates and postgraduates. And for this topic, I would like to thank my colleagues, the seniors, and few of my postgraduates, especially Dr. Ankit Garg, Dr. Sumit, and some other residents. Names are not possible, so many names are there, but I thank them all as a whole, as a team, for development of this intraoperative clinical hepatobiliary score. So let's start our journey. This intraoperative clinical hepatobiliary score, first of all, in the first part we'll go through the details of ICHBS, what is this, why it is required, and what is the scope of this ICHBS, where to apply, the indications. In the next part, we will discuss the Part A assessment. In the third part, we will discuss the Part B assessment. And in the fourth part, finally, we will take up some examples, how to write ICHBS score in the case sheet, and how to use it in day-to-day life. In the management of gallbladder stone disease patients. So let's start. We'll try to understand the concept. As far as the evolution of this ICHBS score is concerned, very quickly I would like to highlight here this. We studied this the number of patients of gallbladder stone disease during September 2015 up to September 2018, almost 37 months. And during this study, we developed this ICHBS score, which is evidence based, and for this received a copyright by Government of India from Government Office in January 2019 for development of this ICHBS scoring system. Now, related to this ICHBS score, we also developed an app with the name of Gallbladder Walk, and that is available on Google Play Store, Android platform, freely available, free download is there. And after installing this app, just register using your mail ID, make your own password, and then re-login. A window will appear to calculate now, and it's very easy. I will recommend just try once. For this also we received a copyright by the Government of India Copyright Office in April 2019 for this app development, and it is used for easy calculation of score for safe outcome decision making in gallbladder stone disease patients and their management. Now the first question comes in our mind, what is ICHBS? Okay, let's see what is this. Just focus on this word. It's an objective scoring system first, and it defines the various difficulty levels for doing laparoscopic cholecystectomy. At present, we are not having any objectively defined difficulty levels for laparoscopic cholecystectomy. So here it is required. And how this ICHBS is going to help us for defining the difficulty levels for laparoscopic cholecystectomy in an objective manner? By assessing the pre-operative parameters as well as intraoperative predictive parameters, and we have combined both these parameters. We have tested it, and after combining these two broad groups of parameters, the pre-operative one and the intraoperative one, the combination or the result is this ICHBS score. What is the use? Yes, by using this ICHBS score, we can opt for suitable laparoscopic technique recommendations for safe cholecystectomy, and by using this score, the outcome can be compared statistically and data can be compared throughout the world for future research and safe outcome during surgery and in post-operative period in patients of gallbladder stone disease. So ICHBS stands for Intra-Operative Clinical Hepato-Biliary Score, and the whole procedure of finding this ICHBS score and its application is known as ICHBS system. What is the use? What is the use of this ICHBS? This ICHBS can assess any patient of gallbladder disease requiring cholecystectomy, a broad one. In a broader way, we can include any patient suffering from gallbladder disease requiring cholecystectomy. This ICHBS score can be applied, and by knowing the ICHBS score, we can opt for suitable recommendation for surgical technique as per the difficulty levels in an objective manner. This is important. There is no subjective decision, in an objective manner defined by a score for safe outcome during laparoscopic cholecystectomy. As this is an objectively defined score, so it can be compared throughout the world. The data can be compared, right? Okay. The next question is, why ICHBS is required at this point of time? The gallbladder surgery is very common. So why this ICHBS is required? There are so many pre-operative predictive parameter studies already available researches have been already done, but these researches for preoperative predictive parameters, they are only available for difficult laparoscopic cholecystectomy, only available, but they are not correlating it, the score or the predictive parameters, they are not correlating it with the ideal surgical technique to be adopted as per the difficulty levels. The difficulty levels not defined. That's why we required this ICHBS system. So this ICHBS system is an attempt for that, for objectively defining the various difficulty levels that can be used during laparoscopic cholecystectomy for getting a safer outcome. This is the first requirement why this ICHBS is required. Secondly, what we have done, we have combined the intraoperative first port findings. Intraoperative first port finding without any definitive intervention. Only required adequate or possible retraction of liver was done, and whatever is visible, that comes under intraoperative first port findings. So we have combined this with this preoperative predictive parameters. We have combined the intraoperative predictive parameters that was visualized during first port finding, and after combining both of them, the various parameters, we can predict and recommend the safe surgical technique for laparoscopic cholecystectomy as per the difficulty levels 1A, 1B, 2A, 2B and difficulty level 3 using a scoring system, and this scoring system is having a statistically significant preoperative as well as intraoperative factors to combine together in that study in the form of ICHBS. Furthermore, we have already extended the population and we are using this ICHBS score in our patients, and we have enlarged the population till now almost 3 times. 3 times of this sample population through which this ICHBS score we have devised. Now, next question is, what are the prospects of ICHBS scoring system? See, before learning any system, we must know, we must convince our mind why I am going to learn it. That's why we are discussing what are the uses or future prospects of ICHBS scoring system. If we are going to use it, what are the advantages we are supposed to get in the future? That's why just go through it. Let's start with the first prospects. If we want to perform a safe laparoscopic cholecystectomy with minimal or no intraoperative complications, and and even in post-operative period, if we want a good sleep, this could be a help for us, this ICHBS scoring system. Second, to compare especially the intraoperative first port findings using an objective scoring system in a statistically significant manner throughout the world, we need an objective system, and ICHBS scoring system is an answer. Next, to compare the statistical data related to laparoscopic cholecystectomy techniques and its outcome, which is reproducible, this is important word, which is we can reproduce the data throughout the world in an objective manner. Again, no subjective assessment. It cannot be different from, let's say, I have noticed something else, somebody has noticed something else. So we cannot compare the two groups. So it should be in an objective manner. The comparison should be in an objective manner. If any surgeon throughout the world is noticing something, any finding in a patient of gallbladder stone, it should be reproducible. It should be identical. It should be in an objective manner. So this is again the answer. The use of ICHBS scoring is there for this purpose also. And finally, this ICHBS scoring system can provide guidelines or recommendations, suggestions for safe surgical intervention in gallbladder disease requiring cholecystectomy based on objectively defined difficulty levels 1A, 1B, 2A, 2B and 3 throughout the world. So these are the prospects of using ICHBS scoring system. So now next question is, why this nomenclature for this score? Okay, we'll focus it. The intraoperative clinical hepatobiliary score. As this nomenclature we have adopted as easy to remember, this nomenclature is easy to remember the relationship of a scoring system with gallbladder and biliary system, as we are using biliary score. Easy to remember for undergraduates and postgraduates, word biliary. And biliary means we can have an idea which organ is related to this ICHBS score. Yes, something related to biliary system. So gallbladder stone disease. We can correlate with this ICHBS score with gallbladder stone disease. Its use reduces the intraoperative hepatobiliary complications. So based on its use, again this nomenclature is justifying the word intraoperative as well as the hepatobiliary. It reduces the intraoperative hepatobiliary complications. And the one word is left. In fact, two words are left, the clinical score. So it's a clinical score considering the history parameters, the factors, various factors in history, the examination findings and investigation parameters as well. Just focus on the word, the clinical and score. So intraoperative clinical hepatobiliary score. That's why we have opted for this nomenclature. And one important thing is, this ICHBS name we have taken as it considers preoperative as well as intraoperative predictive parameters for laparoscopic cholecystectomy in combination, and we can remember it as a mnemonic based on its components. Like I stands for intraoperative parameters. The intraoperative parameters, it has two broad groups, the gallbladder factors and hepatic factors. C stands for clinical examination parameters. H stands for history factors. B stands for biochemical parameters. And S stands for sonography parameters. So that's why this is known as ICHBS, and we have opted for this name, ICHBS, Intraoperative Clinical Hepatobiliary Score. Now, just to start with, after the introduction part, what is this ICHBS, what does it stand for, and why this nomenclature? Just to make this ICHBS score easy, it has two parts, part A and part B. Part A is related to preoperative assessment, whatever we are doing on day-to-day basis in any patient of gallbladder stone disease, the preoperative preparation or assessment. And part B is related to the intraoperative findings and their assessment. Total maximum score in ICHBS scoring system is 40, and total minimum score is 0. So ICHBS score ranges from 0 to 40. It can be 0, it can be 40, or it can be in between 0 to 40 range, right? Components of ICHBS score. So okay, agreed, it has two parts, maximum score 40, minimum score 0. What are the components of part A? The pre-operative components, it contains the history factors, the clinical examination findings, the biochemical parameters, the sonography, abdomen, hepatobiliary findings. These 4 factors come under part A assessment, known as pre-operative assessment or pre-operative components. Whereas in part B, the intraoperative components, it has largely 2 major groups. The various factors under the heading gallbladder factors, and the second one is the various factors, that is hepatic factors related to liver, hepatic factors. Easy. Part A, 4 broad components. Part B, 2 broad components. Part A, preoperative assessment, history, clinical examination, biochemical parameters, sonography. Intraoperative components, part B, gallbladder factors and hepatic factors. Right? In part A, you can see history and clinical examination. Part A, the first 2 factors, A and B, and C and D, the investigation part. After taking history and examination, we usually advise the specific investigation for any particular disease. So again, the C and D relates to the investigation preparation, the investigation of that particular patient. And finally, the diagnosis confirmed, made, and in part B, we have decided for operative procedure. In part B, we are assessing the intraoperative first port finding without any definitive intervention. So gallbladder factors and hepatic factors. These are the components of ICHBS score, what we are going to study. As the video is becoming a bigger one, so this is the first part. I would like to have the final question in this first part video is how to assess ICHBS. Fine sir, we have gone through the ICHBS, what is this, what are the uses of ICHBS, how many parts we are having in ICHBS, but how to assess it? This is the important question now. Preoperative assessment part A, the maximum score is 20, minimum score is 0. Intraoperative assessment part B, maximum score is 20, minimum score is 0. Adding them up, part A plus part B, maximum score 40, minimum score 0. Right? So this is ICHBS, but how to assess it, we will definitely see in the next video, I think. I am not saying thank you to you, all of you, but instead of saying thank you, I would like to end this video lecture by having a video learning quote. If you think you are big, you become small. If you know you are nothing, you become unlimited. That is the beauty of being a human being. Think about it and have a nice day or night, or have a nice time. Okay sir, fine, but still the question remains how to calculate ICHBS. This we are going to see in the next video, part 2, the practical approach to calculate ICHBS. Okay, see you there.